During this period of uncertainty, we would like to say thank you to all our frontline workers who leave their homes every day so that we can stay safe in ours. We are proud of each and every one of you who go above and beyond to carry out your duties, for keeping us healthy, for keeping us safe. Because of you, we are hopeful for the future. Because of you, there is light at the end of the tunnel. We don't have enough words to express our gratitude for your sacrifices. We can only acknowledge it and say thank you. National Health Mission, Government of Meghalaya.
Good evening, everyone. It is my pleasure to welcome you to this program on decoding COVID-19 and vaccination. My name is Dr. Moami Mara, and this program is organized by the National Health Mission, Government of Meghalaya. I hope you have been finding the sessions on decoding COVID-19 informative and educative. Today, the program will be in English and Karo. We will discuss about the various misconceptions versus the reality of COVID-19 vaccine, and we will also be talking about the importance of early testing and early reporting to hospital for treatment. Despite the vaccine now being available in our state, there is still some amount of hesitancy in taking them, although the attitude of the people towards the vaccine is now slowly changing. We have observed that inaccurate information and rumors on COVID-19 vaccine is still spreading widely, and there are various questions and concerns around the safety and efficacy of this vaccine. Many people have lost their lives, either at home or on their way to hospital even before being diagnosed. Therefore, today we will shed light on the fear, confusion, disbelief, and uncertainty towards COVID 19 and vaccination. And we hope that by the end of this program, all the eligible persons will proceed forward to get the vaccine within the time frame and no one will be left behind. Nisoy nga ba sa kantikon, ya programo na rin tsakswa, aro sa kantinan ya tamni namgapa salam ko unsing nagata ska. Ang nibiyamang Dr. Moami Marakunga, aro ya program ko, Meghalaya Solkarini, National Health Mission, taororo ta rakpi gabroro ingaba, coronavirus ni ungating gaba sabisi, COVID-19 gaman, talati unani ko dakna, aro ya sabisi na, tika shuani gamchatani ko biyat na, aro singenang porika ba test katna ribana nangani ko uyate talati unagata ungatinga. Ating adoko, chunga kita COVID-19 ni tika dungo ba? Baka mandirangan, tika ko rana jaja kuinga. Bara na skuja, aron noko, say dungin chimo ba, singganang test, ba porika ko rana ribaja. Chingni kinani, aro masyani kitari, iyarang plakan, kakit ko masyi chinggija, le jangbang bangga baka tarang ko, bibir ay, jaja nirang ko maninga. Yani selan baka mandirang noko bara mao hospital na suknas kangan jangi gana na sukaha. Uni gemen dal ni programo chinga tentang manca ya covid sabisini gemen aro tika shwani bidingo taldapati unanirang ko dakanggen. Aro chinga kadunga ya program ko nikswani jamano plak jajani aro kenanirang na akan cakani ko matgen aro le jang bengbang pa khatarang ko bebe ragija besi chiung pa mandirang COVID-19 tika ko nagata reba token je rakode saksaba tika jagwa mande dongjawa. Dalo chung baksa nam bege pa doktorang tenang aro uamang chini singanirang na agan chake tagatani ko unanggen. With us today, we have panel of expert doctors who will be answering to our questions and help us clarify doubts. First of all, I welcome Dr. Kalkambe Sangma. She is a dermatologist working in Civil Hospital Shillong, and she has been working actively in the COVID ward since the pandemic hit our state in the year 2020. We are also delighted to have in our midst Dr. Victoria Moman. She is a senior medical and health officer in RP Chess Hospital, Shillong. And we are also fortunate to be joined by Dr. Alka Flora Marak. She is a medical specialist in Ganesh Das MCH Hospital, Shillong. Thank you for joining me in the program, doctors. And without any further delay, let me start with the questions. I will be asking in Garo, and the same question will be repeated in English for the benefit of all our viewers. We will also be taking live questions from our audience. And tao jol anga singanirang ko takangin skang pao anga Dr. Alka Flora Marako signagta skinga. Dr. Marak, may gaman mandirang ya COVID-19 ba coronavirus na test ba porika ko rai niya ni ko dakna ng chumota. Aro, sawarang ya porika ko ra na nga, aro ya ko dakani chi may kaya pandemic ba sa jinma patrukrikani ko ding tangat na kita magyan. Yani bidingon ani so nga parang na kantaki tagatani ko dakna magyan ma.
Mutila Dr. Marak. Ya COVID sabishi ko anjing dauro 느끼게 gepro rubat harak ke gepro pa sabishi mangsa sajin ma sagop jiko nanching pandemic ne ganawa uinga mo. To ya sabishi na anjing maina test kan nga maina singinang test kan nga. Maina anjing sabishi ko matno how ba. Ya sabishi ni chin ako miso kuja antang ko sabishi saja antang ko saja ni chanchi mangna test kageja donga ngode. Ya anda ka ba mandirangan je mangan sabishi ni chin ako miso kuja nga chim. Ya mang gepen mandirangan sakkepen no na batat altui batat na wamang masigija. Achini salanti dongrum roromaniyo sakkepen no na batatani ko matna. Aro anjing singenang test ka ay mga ba alam la suspicion ba sa antang ko sa donga ni suspect ka ay mga test kaon. Yara maiko dakchaka na yara anjing early identification ba ya sabishi ko singenang rumsoy mamat ni mga rumsoy mga ya sabishi na sana banani ko nung naman gen endaki mga ya mandian jian ya sabishi ko rasongri mat na hachim wa mandini contact ko dong parang baje mangan wani sepango protection gri ba ya mask kan gija jakshwani ko jakhal gija chethang ke dongi mungna semsakani ko jakhal gija dongman hachim yarang ko wamang ko ching track kai mungna ba sandi mungna wamang ko sagija parangani ko mai katte doni mungna ye sabishi ko patrorwani ko jela patrorwani ko ching champing sona gita matna aro ya anchini India sorkari ni mungbonga mungsongbat kepa jakudi adiba five-fold strategy oba mungsongbat kepa bakong geo anching testing ko naka tracking ko naka treating vaccination aro COVID appropriate testing na anching antana ko test kaani tracking de je mandirangan ya sagba mandirang mong contact donga hachim ba dongrum rorum hachim wamang ko anching sandi mangna ya gaprorwani ko champing na matgen ba transmission ko break kana matgen aro yamangko namgapa sana bananim ko singenang nem na wamangko namgija bat pa gadong na suka ka chin hamping na matgen aro yan baksa vaccination ba tika shu ani jerangan ta besi chung hachim je manganya tika ko ra na matna chem wamang vaccination ko ra ai mangna aro COVID appropriate behaviors je kai mask kanani saksa sakabani chethang rke dongani hand hygiene ba jakshu jrungani sabun chichi yongbo alcohol sanitizer chi yongbo aro ancheng ongkata haun mask double masking khani aro saksa aro ke gathering ban ke jinma program rong ata ongat parang ko dakki jani yarang chi ancheng meba sabishi batrani ko dontongat na matna aro sawarang yako test khana matna yako jokon je mangan skang kapade je mangan ya sabishi sagop ni chin ra ko mesok nya chim je kai ben shuan ben pretani ba fever je ko nakana ching je mangan ben sa dikinga ben being jumingan ko jiko na ching jakalamun normal nomenclature dakim nos ko sa dekani ba gushu ani adak nang badak tong hija basak wada anchim mukun gachakani ko nikken basak wada gengteng changketani ba tuani ko mashigijani bibarang ko mashigijani aro nangana batin nikngani mamung kamko ndakte dakujengin chimno bawa nikngani je na chingni beino nyok kate wako anching mashani aro ultimately rangsi sokijani yarang je mangan dakaba size namsan dongachim aro je mangan dauroni getal variant de okri ani ba diarrhea je ko nakana mo wa dakiba mi soknya sun dakaparang dongkin chimode antan tangko singinang test kana nanga antan tangko voluntary pa tangan kangi ra emangna chakchigi jan antan tangko test kana nanga yana agreba je mangan science symptoms ba chin mi sok khujenga chem indio mangwo wamang covid positive patient mang contact donga hachim precaution gri ndak ba mandira antan tangko test kana nang chongota antan tangko sepang bat ko health center ne yang na test kana nanga ndaki mang je mangan biap damsano sori sagop matninga chimjinma test khakuja dakmo sori sagop matninga chim dakaba biap nyung ingin chimoba yang phachina mo latinga aro je mangan apalchi india ni apalchi ba india bo ongjamena je rangon covid belonging achim covid jeling achim dakaba biap rangoni maiba kamna porena songri bangin chim odi yamang nakaba mandirang ba test kana nongchung mota aro mungsong batte je mangan vaccine ko rakhu jenga chim ndakpa mandira antan ko test kana nang chungmuta aro ya antan ko kangira nananga yarangko aro ya test kani chi ya ndakple widespread testing kani chi bagmukko test kani screen kani ching micro matna muksonga ya testingan ya sabishi ko china amna gtadis khangpa kiyo ngamena anching testing ka esa sawa sajinga ko mashi mungna sagaba mandiko maikate doni mangna batror wani ko jelrur wani ko anching something sona mana aro yamang ko singinang anching mamangin chimno de singinang jakhu diani rangko dakna mangin sana banani ko na mangin wamang namgi jawba gadang wala sokpang jachina anching sana sansona mangin aro yarang baksa vaccine shu ani ka chung jakhalgen chimode anching ye sabishi sagopni jelru ani ko jumping na ma chungmotken aro expert rangni akana khan ching na ong ode tika shu ani ya asong damsa o percent so chet 80% batahan ode ya sabishira chingko ndak play problem wat jo haba ya chingko ndak play effect kha jo ha nigman ya vaccination de nangchung mut ko nga along with early screening and early testing
Matera Dr. Alka nambe thalatani na dao jol nga Dr. Kalkambe e sangmako gupen question ko ask kana tas kinga Dr. Sangma na ni swing pa rang na thalat na mangen ma mai ni gaman acheng COVID-19 ni Chicago shutna gata nang chungmota mungpan naras ani rang baka mande rang ya tikani side effects baja dreng ani rang donga aro je mangan COVID-19 sabishi ko manachem ba namplachem wa mangde ya Chicago ra na gata nang jane yani bidding on out chitis lat na gata mangen ma
Betul Dr. Moni yes anina ya COVID tika shuanira namen nang chumat kapa maina anching ya bilsio COVID sabisini keproro ba jelro ani ko lipna gata maninga aro baka mandirangan je mangan chadamberang jerangan blakka wasa pamamung sanirang dongja wanda keparang ni belong ni sanirang ko manani ko aro mandirang ni sianirang ko ba anching ya bilsio lipna gata manaha aro maninga ndaki ngingon anching tikarang ko suani chisa yarang ko camping sona gata yang nambat kepa cholonga tau ya tika suani ra anching ko mai take dak chaka skang kepa o anching tika suani ra anching ni covid sabisi ko matnengani na chui matnengani ko komiata aro genik pa o yang gen chimo ode anching covid 19 ba covid isku sabisi ko matne blonge sani ko manani aro shauna sokawni ko camping sona ba yara ba camping sona ba komiat na gata dakchaka aro gatam pa o anching sia tikarangko sugenchim ode sabi sini geproroani ko anting champeng sona aro ndake antingi nuksu sumsuli mandirangko ya sako manawni ko naljokatna gitaba daksaken. Daw anjing banga mandirang ni ya jika suani side effect rangna kenani ba jajringani rangko anjing kena sona geta mana indi ba angan dake yako thalata geta skinga ya vaksinara namen safe ngapa jen naljo gapa aba aro effective ngapa mo ba kham kha gapa vaccine wa ni gemen anjing mamu dake bena jajringna geta nangja aro side effect rangara belongin komia ba belongja ba maike akan get mile sangaya aro deptiksa salangna san dungaya dake mang ya side effect rang jekai jeng BN denga BN niknga aro matam rang de biji sugpa biapo sadekani rang aro wandeke matam mande rang de dike BN nikani rang ko makna diba ya rang ara deptiksa nasan ungaya Uni gemen ya rangna jajringna geta jeng nangja aro tikarangko nak simang mamung nekani grian shuna geta mangen dake mengna anjing betam rangde sengani rang dungamo jekai covid mangen chimhang ode wamang ya tikarangko shuna geta nangja waha dake chanchia indi ba ya nangan dake akana geta ska jemangan covid saniko manne nampla hacham wamang ba ya tikako shuna geta nangchong mata maina baditana nangni wara chakani ba immunity power mo donga anjing masija uni gemen ya tikarangko shuani chira ya sabisiko manthaina geta ba manaya aro ya ho manthaigen chimo uba niba na tika shugemen gen chimo ode ya blonge saniko aro shauniko champingna geta dakchaka aro anjing da ororode nikna geta maninga getal rokomni virus ba new variants mo ungkatani rangko anjing kena sona geta matninga aro metam rangde blongen blonge saniko atna geta matna ya bersidi anjing bangen dike blonge sani rangko ba nikaha aro mandirangi janggirang ba bangen gemaha ya rangko anjing wara chaksona de anjing antang-tangko aro banga ya mandirangko anjing chika suani chisa ya rangko wara chaksona geta matgen ini kemen kami dake akan geta ska chika suani rang anjing sakkan chini daitu ba jutiong chongmota anchingni kami anching atang-tangko sanongja diba anchingni community ko ya sabishoni ko naljoke rakina ba wara chaksona geta chela
Thank you, Dr. Sangma. But for the benefit of the viewers, I would want to ask you this in English also. Can you tell the audience why vaccination against COVID-19 is important? Can you please summarize on that?
Okay. Yeah, I've been telling it, Garo. We all know that this year the virus is spreading very quickly and it is affecting very even the young and the healthy people. So we really need to act fast to tackle this COVID-19 infection. And the best thing that we can do to protect ourselves, our families, and our community is to get ourselves vaccinated. Now, why do we need to get vaccinated? Now, number one, this vaccination can significantly reduce the risk of getting infected with COVID. And secondly, it can help prevent death or severe infection, even if one gets COVID infection. And thirdly, to reduce the spread of virus and help protect our family and the community. Now, most of the people are scared of the vaccine side effects, but we must understand that the vaccine is safe and effective. And the side effects from the vaccine are mild and they last only for a few days. Now, the common side effects are fever, pain at the injection site, then fatigue or body ache, which these side effects and some side effects such as fever are the signs that your immune system is fighting the vaccine. So it means that your immune system is working. So again, there are people who think that their natural immunity is strong enough to fight the virus and infection. And people who have been infected with COVID with the virus before, they do not need to get vaccinated. But now I would like to say or stress on that you should get vaccinated even if you have been infected by the virus, or you have got infected with the COVID-19, because even for few reasons. So the number one is like we can't predict who will or will not get the severe infection. And in fact, now we, as I have said, that many young people and healthy people without any underlying disease also, they have got severely affected by COVID-19. And we have seen so many people losing their lives. And even if you have COVID before, you can get reinfected. And then thirdly, there are new variants of the virus are emerging, and some of which can be very, very infectious. And so we can stop this by only getting ourselves vaccinated as soon as possible. And lastly, I would like to say that we all have a moral duty to get vaccinated for our community. Thank you.
Thank you, Dr. Samba. Now we're going to take a short break, and please listen to the health message.
Ôi nặng pa Ngadi am jing juk mi jalanin bi nan dak plan sing jinga aro bi en ban dak planning inga
Mai nga?
Ngadi bi en ding skinga aro suldi gu shuman ninga angko check up ka in yu nam kin ko
Thế chala ina ba check up kana nangama yara bulshi antin shordi gusude dong chumaya ba wa chi khari shop joko de check up kana nang jamaja nin na mangai gen
na adi ya khata ko aga nan sal tham playing jok te ayo adi ne in jok tu shine ikuna
Oi nangma oi ya michike ma yong jok oi nangma oi
Maya ang gusto hospital o na may nukon ang adi am jing juk wala ang na sani number do nang padunga sa bri sa zero
Pano
wang ni beko
Hello Angi dak wala gada nasima dak panabe narani gusuode ben dengode o kriode nengokode swe thoa thogi jako masi jaude gengthung mamung bibako mamjaude rangsan antangko sakkebanoni cheli dongatbo aro covid 19 ko test kainibo nokko dongo maiba rokomgni dakwa maxko ganrongbo
National Health Mission, Government of Meghalaya.
Dao Jojo Langa, Dr. Victoria Momanko, Skanks Kanagatas Kinga. Dr. Moman, Adno Tumbuba Mit, Marangba, Baji Mangan, Oko Kina, Chanchi Samsuing Achim, Aro Bisana So, Bachoko, Kaningapa Magbarangara, Tikako, Ranagata, Managinma. Aro Mugapanara, COVID ni Tikana, Sabat, Bat Kijanigaman Baka, Gija Jangkung Banganirang Bunga. Nayanigaman, and Swing Parang na Agan Pateniko, Dakana Muguna.
Matela Dr. Moari Mara. Good evening, everyone. Yan ambipa tamis halo anga kemuk niswenga ba sakantina yan ambipa salamko unask chinga. COVID-19 tika ko shuanyo kamakina nirang aru iseta nirang ni aselsa endaki mandirang na jajata nirang sukpainga. Uni gemen yani gemen nambate aru talbate sakantikon sing sandina geta anga nasima sakantikon didinaska. Ye COVID-19 tika shuanichi darang mandina miaba mechek ongchong infertile ba bisha managata champingani donggen ne jangbangani rang ongchong motja maina yana mamung scientific sakhi dongja patisa ye tika ko shuaniara asel nangauni ko teltakswa gata sawa maina ye tika ko name sandi aru nye dakani ba scientific research ba testing genang sa thariaha unigman ye tika ko shuanyo mamang jajingani gri plakan shuna mangen government of India ye tika ko shuna gata be genange aru namneke bisana sokhaneng pa maana aru ni dena mamung dakeba kinani aru jajringani dongna nangja ni wiataha. Maina ya COVID-19 tika ko shuanio maa aru dena kinani dongani mamung scientific sakhi dongja. Bisarangko dengtang mancha sangapa doktorang ba chung English si pediatrician ya gana wamangni aganani getade ya COVID-19 tika ko maana shuanio bisana aro bisana batisa ya sauniko chelchak sona geta ba immunity ko bariatna getasa unga uni gemen sok kaning gepa mak geparang mamung jadring agri ya tika ko shuna mangen anu dong pa mak geparang na ya covid tika ko shuani bidungo chunga geta sandianirang dongku jachem uni gemen anchungni Meghalaya Sarkar ye Government of India ba India Sarkar ya tika ko anu dong gepa mak geparang na unku jengachem endi ba July ni gindi tariko Ministry of Health and Family Welfare Government of India ye tika ko anu donggapa magaparang na shuna gata manaigen ne agan thalatani ko ba didiatani ko naha ya tika ko rao magaparang na namgni bangbatani gemen in India anu donggapa magaparang nabam mamung ningkani ko Rabajoa ne baptisa ye tika ko suchina anu dongpa mi chkrangna ye COVID-19 ni ko chelchak swagata ungen ne wamang parakha anu dongpa magaparang ya COVID sabisi ko mangen semode haida baldme sako manaba gnachum ba okko dongengpa bichana kengnirang ba namgija wanirang dongnaba gdonga uni gemen sakhirang ko matne aru chunga geta sandiani ko dakani jamano indiani sorkari magaparang na ya covid tika ko shuna geta manaigen ne thalati unaha angni abachingo aganani geta maaso khanengpa aru ji mangan bisha dongna skingachim aru nuktang ba ku dakna mingachim aro anu donggapa magaparang wamang sakantian jajring bija ya tika ko na shuna mangen Matela.
Okay, Matela, Dr. Momin. What I was asking Dr. Momin is that there are a lot of concern among women on infertility and COVID-19 vaccine. So, and also they are concerned about the vaccination being safe for the pregnant women and breastfeeding mothers. So, Dr. Momin, can you please tell our audience about this?
These are just rumors of misconceptions. There is no scientific evidence to suggest that COVID-19 vaccination causes infertility, either in both men or in women. The vaccines have been found to be safe and effective because these vaccines have gone through rigorous scientific testing and research. In fact, the government of India has given its approval to administer this COVID-19 vaccine to all breastfeeding women who wish to take the dose. Most of the pediatricians have said that it may be even beneficial for the baby by building relative immunity to the child. Earlier, pregnant women were not recommended to take the COVID vaccine because we do not know what the effects of the vaccine would have been on the pregnant mother and the child. A national consultation on the matter was held in June, involving the representation of the state government, medical colleges, FOXI, NGOs, and other partners, and they unanimously welcomed the recommendations of the National Technology Advisory Group on Immunization to vaccinate pregnant women on COVID-19. And on July 2nd, the Ministry of Health and Family Welfare and the Government of India have recommended this vaccine that they can vaccinate pregnant women. First of all, I would like to say or state why this COVID vaccine is being recommended for pregnant women. Most pregnant women will be asymptomatic at first or may have a mild disease, but their health may deteriorate rapidly, and that may affect a fetus or the unborn child. Therefore, it is important that a pregnant woman takes all the precautionary measures like wearing a mask, maintaining social distancing, washing her hands regularly, and along with the necessary COVID vaccine. Therefore, I would like to recommend all the pregnant women to kindly consider taking the COVID vaccine. And as I've mentioned at the beginning, the COVID-19 vaccine does not affect fertility for a woman to get pregnant, or any breastfeeding woman, or a woman who intends to start a family, or a pregnant woman. So all these groups can safely take the vaccine. Thank you.
Thank you, Dr. Momen. It is indeed a great news that now the vaccine is safe even for the pregnant women. Now we'll be having a live caller. So can we have the live caller, please?
Hello.
Hello.
Sakandi doktor na natanam aro telaya sumakon anina Dr. Momiko. Dike ango pamungsa skani kusnak tas kinga na ang vaccination kura anak tas kinga di bango siya adita jaja nila nongia menanga hazak ni snio stroke ha aro stroke ani tamono de anga medication nongia aro dike dao anga sam ngitam ko jakalinga awa samrang aro ungjok new hands naken bani Levi Grace aro EcoSprint 75 ko anga dao sam ko jakalani ko takinga nengunia sam ko jakalingon angara vaccination nakta managen ma kasapay ang na thalat nakta managen ma matela
Matela, Eliza Sangma, dao nangis ngani ko anga Dr. Alka Flora Marako agan chakatude nang begin.
Good evening, Liza. Nani sekarang pa nani na nangko Matela. So, ang akan chakanide yan na stroke man jok chim una na sam ringing achim. Ya kat na de wa category ga aka je mangan ya ko ra na nang chungmuta aru ma chungmuta. Mina je mangan sabi chi dong chapa chi momang na de vaccine shuanian jaman jaunan asumna protection gata ongen. Aru je samang ko na dao chakaling achim mo je rang ko na knarukto. Warang mamung kita nani vaccine nang interference nongja. Nani vaccine shuani na mamung kita ba namgijani ko ba judging ani ko ra pachawa. Nimen judging gije vaccine ko nani sepang wat ba center yani shuepa.
matela
Eliza Sangma, nangni sengani rang nagan chakani ko matnahan yang kadonga, dao wancina aru saksa phone kain gepadonga, upa chung jojol agan chakang na bini sengani rang. Can we have another live caller?
Hello.
Hello, Mr. A.M. Sarkar.
Hello, doctor. Hello.
Yes, hello, A.M. Sarkar. We can hear you.
Yeah, the volume is very low. Okay. So, my name is Mr. A.M. Sarkar. I am a paramedical staff here in Shillong, District Medical and Health Office. So, madam, regarding the vaccine, one of my cousin brother, he in the past he had gone for angioplasty, heart angioplasty. So will he be safe if he takes the vaccine?
Thank you, Dr. Sarkar, for that very good question. And I would ask our medical specialist, Dr. Alka Sangma Marak, to again answer to his question.
Good evening, Mr. Sarkar. Yeah, in regards to your question, your cousin who has undergone angioplasty, he is in fact a perfect candidate for the vaccine because he has comorbidities, and the vaccine does not interfere with any of his angioplasty medications. In fact, it will do him more good than harm. So I would recommend you give him the vaccine at the earliest, because people with comorbidities are the ones who are to be taking the vaccine as soon as possible. I hope that answers your question.
I hope
thank you.
Dr. Sarkari have found your answers. Thank you, Dr. Alka, for answering to his queries. And now, while we are waiting for questions from our viewers, I think we can take on some questions which were asked in the previous sessions but could not be answered due to lack of time. I would want to ask Dr. Kalkambe Sangma that can people with food and medicine allergies take a COVID vaccine? Dr. Sangma?
Yes, those who are allergic to food or medicine can also take the vaccine. Now, most of the people who have these allergies are mostly the skin allergy. Then some people, they have a food or for the pollens or even some environmental allergies. Now, we have to understand that these allergic reactions are of two types. One is mild and the other one is a severe allergic reaction. Now, when we say mild, we will have some itchy red spots on our skin, which will go after some time. Now, severe reactions is when you experience, sudden breathlessness, and some people, they can have swelling on the mouth or the tongue, and suddenly they will feel breathless, and there will be sudden drop in the blood pressure. Now, again, these mild allergic reactions can have a acute, that meaning they can have allergy at that present moment, which lasts for few days. And the chronic allergy means which are for lasting for a long time or having for a long duration. Now, if you have an acute allergy at the time of your vaccination, I would say that you can defer your vaccination till you recover after taking your medicines and getting recovered. And if you have a chronic allergy, as I said, if you are having for a long time, and at the time of your taking vaccine, you don't have any signs or symptoms of your allergy, then you can go ahead and take the vaccine. Now, if you have a history of severe allergic reaction in the past, still you can take the vaccine because you may not get the same reaction to the vaccine. And so far, the vaccine is safe and there's no adverse effects have been reported. So, however, for those who are having severe allergic reaction and even for others also, we encourage those who are vaccinated to remain in the vaccination site for 30 minutes for observation. Thank you.
Thank you, Dr. Sangma. We are having another live call on the show, so we will get to that.
Hello? Ya, saya Nina Sylvia. Saya Dr. Victoria Moment tak umum salah tahan. Mak kebarang pa tak uji vaksin nak nama yang ini. Tapi mungkin clarification kita sangat. Mak keba pregnancy nak ni high risk pregnancy umode. Unura ya kahush nama ingin aro mak keba comorbidities tunga ka kode dong chapode aro high risk pregnancy ode unura ya kachi shwani chi mamang ba side effect duang jama kusuk nasnya Matela
Matela Mrs. A Sangma nang isang anina aro nga Dr. Victoria Moment ko request ka ating yan nang isang anina akan chakanin ko o nang nagta
atamnam Mrs. A Sangma nang isang anina Matela nang ni agaran ni kita de ya high risk patient nara high blood pressure ko muksung yama
diabetic high blood pressure aro my first trimester aro my high risk my pregnancy bed rest to dona kana
okay pregnancy na shuna gata government ni agana ni gita de actually English ni agana gita de my macam tau study ungkweng amo mijal mangmangsa bisong approval onaha mijal 2 July usa approval onaha indi ba je mandirangan ba je maaan high risk ongachim wa na shuna gata shu nambatken ani ya chini government ya daiko naha na clear ngai hama ma
Dr. Alka nak ba yako titi talat na mangin ma Mrs. A Sangmani Sunganina. Mrs. A Sangman akan nai ma. Dr. Alka.
Hello, Mrs. A. Sangma. Is she still online?
Yeah, I'm still live.
Yes, she's still online.
Yes, ngani ko akan sak na kita. Actually, yeah, vaccine benefits outweigh the risks. No, saksa pregnant lady ko anchi chanchi bo ano nong ba mago saksa anching immune compromise ne chanchi na man gen. Mo je an aro andaka situation no. Biya COVID pa mandap na nanga de vaccination gree without any protection. Uno de bina wa pregnant lady na wa ano dong ba magapa na risks batinga. Unigimen ya vaccine ko rana nangaw nagakni. It is important that she takes the vaccine because with the comorbidities, she is in risk of having a more severe infection. If at all she gets the disease. May ba takirasong granichi bewas ya sabi shi ko matna nang ya bini sabi shi gemuk ni kosa ko ya ko mandap na nanggin chimno de. Ya ano nong ba magapana ken na nang bat syangan yonggen. Uni gemen sepang bat ko health center ni ang chengi mangna na uni doktor ko grong cheng na mangin daud tong kueng ngak de. Indi ba daud krian mamang jajengan ni krian shoot na de matna de nanga aro nanga ba nang chong mota. Mene ya wa ano dong pa magpana namgini ko san rabagen namgi jani ko de raban gapa sakhi dong kuja ba test wamao khagpa rango mamang side effects dong na nanga ko de dongan gapa de dongja ni ba na mano nambata ini ba doubts dong kuing en chino de antani sepang bat pa doktor ni ayamang na antani situation ko explain ka ayamang na ya vaccine ko rana matgen ini barana matno de nambata mena risk na batte benefits bata. I hope that answers the question.
Betela Dr. Alka nambe talatanina anga bebera dia nis nganirang na angan chakani ko matnahani. Taw anching tiktiksa break ko rang na uni jamano jol anching mandirang nis nganirang na angan chakang ko gen.
Janggini rama ng ijakon Namgija sabi siko chachak na ba ng ijakon Chak susrung mas kugane rong talantale Jan mauro gijan tang duding tang samsake Ongija koborang kuk na jana tika ko suwe haywara chakna Corona jat pasija kangal cha asiata Donga sumoy cheyani damsan jaku dia chikenagri kenal na kenagri kenal na for better tomorrow for better tomorrow kumongnya talat mo unat mo
National Health Mission, Government of Meghalaya.
Welcome back. Now we will be taking questions from our audience. We have with us Mr. Simon George, and he wants to know, Dr. Alka, double mask kanimang COVID positive ang ba mandi ko, guna manoda na Japani dungama. Ini bias ngatingan.
Thank you, Mr. Simon George Marakoni question na. Double mask mama ungi ja. Double mask ko ni kungsade N95 hong na nanggen. Aro na agrong na anggen chim no ba. At least 6 feet chelaw ni ba una batte chelaw ni wa mandi menggulpo na di mangen. Hindi ba wa mang ni si pangchi ang na manja wa mako dang tap na manja wa chelaw ni golpo kay mang na aro maximum 15 minutes, but less than 15 minutes exposure ang ato nambat ken. Aro as soon as naawa biapon yung katanga ha, you can ji anjing COVID appropriate behavior anjing hand hygiene do abo sabun chichi jakshwani ba alcohol sanitizer jakhalani ayang ko jakkenchim no the risk kumia. Enda ko mangba I would rather angi akan ako ra genchim mode wamang ko salchikang tom noko ning taklo chingi mangna salchikang jamno wamang ko gunay ango nambatkin ngpa ko nga akan gen. I hope that answers your question, Mr. Simon.
COVID sagabako grunga yang ginchmo de chelaw ni grungo nambatkin mas rangko namme gani mangna Dr. Alkhani aganagaman kita chelaw ni ba open space so grunga ode mabunggo jawa ni ba na song distance ko namen maintain kana gata nanggen. Aro dawat chunga saksa viewers natinga Salina Mara. Doctor, bein ko aro skin rango allergic donga aro pressure sugar da kaparang dungura. Sita shuna manggen ma manja unti sa thalato de mitcha begin. Doctor kalkam sangman ayani gaman nakan sakat manggen ma.
Pressure sugar da kaparang dungura. beinin allergic donga parang aga dashi ko English chiba ganata ha. Daw ko garochi namme ta ganatla aganatte kangpao ya allergic mo ya allergic kara anjini allergic reaction ara banga changon skin allergy khakhtani rang batamo aro matam lang de maina kana anjini full bibalang ni colons barang na allergy gok na gtamana sau barang de haida samrang ni asel skin no sa khat ken allergic de ba samrang ni asel ba na dingtang environment ni ba cement bawa di chemical dingtang orang na ba allergy gok na gtamana ya. Tahu dia allergy kara dia kini rokom benang gisara mild form ba belong gica kepa aru gisa di severe ko ba jeko na angin jumri belong ba severe allergic reaction inosa yang de phangsaken mo uni gemen matam ran jekai belong gica ba mild reaction allergic reaction ang de na be no khakte diktik sana san orang de liba dongai de liba khakte gacak takke dak keparang dongamo indi ba jen salu chunga severe allergy reaction ya kana uno de na kucerang boa ba getok rang rak araw ba boeng na arang snarang manjawa araw anake suddenly nang ni high blood pressure rang ba thakona ba ganang ko de severe allergic reaction ba allergic reaction mo uni gemen na nang ni allergic kara severe ko pa ma mild ko pa kun awichina nanggen mo araw ya nak parang ba na da siya nga English chibaw ko na akanata ha na ayarang ko vaccine alas kang yarang ko machine agta nanggen ara severe reaction ma nang ni ma allergic problem ra mild aro gesa rong thaya mild longgen chmo ba na ara nang ni allergic ra na ara acute phase ma je ko nagan gen chmo de dao na dao gata somoy na allergic ko nga wa ko ba wada dipiksa somoy rang nasan ode tumaya wala ko ba allergy ba uta besirang na ay allergic problem ba nga reception na man ya nak ba problem mo kon chronic allergic reaction mo chronic allergy problem dao de acute allergy na dao gench mo nga ode no de na vaccine shuani ko na diptiksana tontong chinag tananggen aro na warang na nang allergic problem na samrang ko ai na mat tani jamano namplani jamano na mamung jajeng ani gri vaccine ko shinagta manaigen aru ya chronic ko parang je mangan utarang na ya allergic rang ngi achim warang de nagta managen mamu jajeng ani dongja andake mang je mangan batang men somoy rang ba past history severe allergic reaction donggen chimo mangba wamangba ya vaccine ko nagta manaya maina ya vaccine ara safe wa aru da out pete nike adverse reaction rang ko anchang krana man kuja aru dong kuja uni gemen ai rang ko nagta manaya Hindi ba mangsara udok na ya vaccine ko raingon na minute kola china observation dongna gata nanggen maina bangpat ta severe allergic reaction rangan within 30 minutes song batamu kola minute kola chini kemensa bisa ko ngong bata uni kemensa dawan sing vaccine shuing oba na simangko minute kola china observation doninga aro ya nakaba vaccine center ora sing doktorang donga na song reaction biologic problem dongge chimomba yang ko handle kana sing doktorang donga nurses rang donga uni kemen na song mamung jajinga nigri ya vaccine ko shuna gata rana gata malagen aro mengsara bini singani da sugar dongo shuna matgen mane menamo tak si anjing ko ya medical specialist akan natahan sugar problem donga ode you are the right candidate ini kemen na shuna gata malagen mana ya sugar de yang ni comorbidity song yani mana chomot na nga aro yan nani yan first priority ko rai shuna nang gata matgen metela chanche clear wai hakon
aro success Francois marak andake singatinga Dr. Alka Flora marak ni agan nagata sai nam COVID check kagi jan namayen hindi ba mandi an tangko belakat na nang ska nakni agan nagata sai mong nampuljo COVID check kagi jan namay de hindi ba ang tangko belakat na nang ska kanga bini question ko bangi mashi jenga namirong ta jani gaman Dr. Alka na mashi nga bini siya tako ang kita de dia COVID sai mga
sanga hachim kon hoy sanga hachim dakki mangna check kagi jan
nampla kon
hindi ba check kagi de ando COVID
may ki belakat ken ne da obvious nga kon COVID sani jamano
okay. Antha belakat mo kita diwan anchini anchini dakrong bewal kita regular exercise kana nangen dakre biljeme exercise hongja normal exercises walking power walks kana mangen alam noko steps tonga ande warangko changini changgatam up down kana mangen not rigorous exercise dakim na antang chani ngani simsak nangen hydration maintain kana nangen antini chi ngani aba chi da kabarang ko nga kan ching bangat nangin hydration maintain kana yan tang ko ranat na nang jawa daki mangna fresh fruits fresh vegetables chani ngani simsaki na tang ko belakat na matgen anga kadonga I mean I hope answers that question
sebati sangma ndake singat skainga doctor kasapai yakuba thalation pabo je mandean PCOD sa dongguparang ara ya biji ko COVID vaccine shuna managen ma nasimangni yani gemen ba uyatani ko on pabo metela andene was atinga PCOD donggupa rangba ya vaccine ko ra nagata magena ma
manchong mata mamang jajingai dongja mamang jajingai gri mamang hinani gri nasimang yangi mangna antang ko shui bana mangen mamang jajingai dongja
Matela Dr. Alka sengsil di shira nakis ngatinga doctors ya chika ko shunara shunaskang skin test kana gata nang jama maina matam vaccination center ang ode mamung check up ka agri sa dunga dungija ko singanirang ba test ka anirang ko dakja shujolaya Dr. Momen ayana akan sakat kana gata magema Dr. Momen
Matela sengsil di shira yan ang nis nganina J COVID vaccination center on ay anggentum
Dr. Momeni network namjaya kon Dr. Sangman ayani gaman akan cakas kana mangima
yang jika ko shuna gata jing mamung skin test kana gata nangja maina aga da shina kana ha ya ra blungen safe nga aro na ya vaccine shuna skang mamung da skin test kana gata nangjawa da shi anga allergic ni gaman ba kana ha haida nang ni jajring anira ya ko skin test ka gita shigen mode allergic na khinning na ba kana ndi mangba angni da shi aga na ha gata mamung jajring na gata nangja aroba wasan bu dan asimang kora in 30 minutes nade observation o pangnan dongnak ta na bamo uni kemen ang ya 30 minutes na so mamong ba reaction ko manja ge chimo de asimang jajing na ta nangja tao de pitnga ngechni numan swani kita de darang ba mamong complain ba dongja na be no chiti kha gen chimo mang ba warang din daw kita na so substitution ba antihistamine na kabarang ko sir ni nampula kita manaya ba at the most severe ko chizo bang kala ode na so chinga prednisol na ko na kita manna di ba ya center ora chara doktorang donga nurses rang donga any reaction ba na so khakata ko chabang gen chimo mo ba yana jajeng na kita nang so doctor sanga ni rang ko manage kana kita manai gen ini kemen mamu skin test kami kan ayat chika ko na kita manaya
Matela, Dr. Sangma, Nambe Talatanina, Shalim, Manda Sangma, SMS, Denis Gatskanga, positive Manani Gaman, isolation Machotani Jamano, RAT test Katana Niam Dongjama, Nijao, Angni isolation Machote, Katana Mora, Patna Jitaka, Unasa, Singatanga. Beyond the case Singatinga, positive Ani Jamanura, government era, red test ko nagata order baniam tungjama ni singating dibakan sa katami ko nagata magin
akan sakat na ya daog Meghalaya Sorkari ni gatal guidelines kata de salchikeng quarantine ba isolation macho ta hang ode aro ya salchikeng ni gisep ko wad bon kam gapa salgat tamo malung fever dong jang ode mamang rangsi sokinya dongjang ode aro saturation ba beno oxygen ni komia ni dongjang ngaunode patient ko test khathena nangja angpa ko Sorkarian guidelines onjo unigimen da ode je mangan salchikeng nami sadap kija isolation macho tang hachin warang ko de salchikeng jamano anching cure ne chane mangna test ko khathei jajo
Matela, Dr. Alka, dawancheng Mukti or Maragnis ako kelas kana Caesar na samrangeng parangara COVID-19 na tika shuma manggen ma doktor. Dr. Alka na ya pangan sa katuloy ng tagain.
Mitela Mr. Mukti nangis anila. Howe beben dashi akan gumengita seizure ba mekyanan chi matri sanya kan dino. Mat epilepsy ba seizure saga parang wa mangba comorbidities kenang pa mandirangon ka. Unigman wa mangba ya vaccine ko na nang chung matan na chung pa grupo kaka unigman ang recommend kagin na semua vaccine ko jirang seizure dong yechim jajeng gija antang tangko sui pachina kita mo natin
Matela, Dr. Alka, daw Jojo Sangma Frederick ni sinani ko niyang kana cotton mask ganayara mamung champing ani dongjawama. Yes, natin cotton mask mamang ko ganwa ay naman. Dr. Victoria
mamang ko ganja kuri thoja anda ko mamba cotton mask mang ganna de 30% sun protection offer kaya 30% ba kola 30% sun na protection ko nenga aro yako akanon are we willing to take that risk ancheng mask khangini ganne mangna tang ko 80 to 90% maybe around N95 ka gana or up to 95% antang protected on the skin ma wa cloth mask ko ganim na antang ko risk ko atke so anga na song facts ko sanot na nga cotton mask te khangsa cotton mask na khali 30% protection ko sanot na again uniman khangsa doctors sang de ya ko recommend kha jawa what do you say Dr. Sangma
Howe aro wasan bong ja banga changon mask kaning on kochin ko bong china je ko bong china banga changon nos gutuni khamau sa kan to patro aya uni kemen body kana khingkhia protection on gen uni kemen san asunang kotni ko mask kan gen chimo it should be fully covered mo namme ke cover khana nanga aro mana de pete dao de N95 ko recommend ka ba double mask kana tab mana gen
saksan onggen mo ba bang pa biap rang ode cotton mask isa mamang ko ba ganna manna ba dunga andi ba crowded place ba mandi bang ba biap rang ode mask ikni ganon nambata menal ch mara kandake singas khenga angaba mija ko group ku tarik juno second dose kushwaha mamung ba ngade uja vaccine shon pa round chi ko bangi ngode nambata one chi po mako rang phabo khenani de dongja ni bia aganatinga.
Very valid comment. Ay ako gumukon dakpachina kita mulat. It's a very valid comment.
Bia
Thank you,
thangi
Minal.
testimony ko natin akon bia dos
Yes.
kay gini kuha hana
Thank you.
dos shuman na ni
Yeah,
jama umako nga hana takem na mamung side effects pa bia manjana matela nang ini ke chung naga natani giman aro gupen nang ba iko kunai encourage chonggen yang akna kadunga Singselbert S. Boldak and the gis ngat kenga chichet onga baba COVID vaccine shuna mat naigin no mat naigin man gis natin kan dosi chichet onga parang ba COVID vaccine ko shuna gata mat naigin man bune dia natin.
Yes, absolutely.
Dosi chichet
Si chisa apa?
vaccine ko
Pangan situ kaya.
kumaga swing ha dosi chichet kapahau din na vaccine ko shuna gatan nang thela. Question magsa ko miss kakahan Henry Gifford B. Marak the case at Kenya. What if second dose of COVID-19 is not taken? COVID-19 ni gani pa second dose ko ra jaura may ungen anebia at Kenya.
Dr. Sangma.
See, actually, it is highly recommended that you should take the second dose because if even if you have taken the first dose, of course you will get the immunity. But if you get the second dose, then it will boost up your immunity and it will give you a more stronger antibody. So I will recommend that you must take your scheduled second dose of vaccine.
Question ng bangkoy nga di ba nga gini question ko sa nakan sa kayo no? Ritsing gabugre moment dikis nga kaya tinnitus tunggu ba patient ng ara mamung ba kinani dongjawa ma ya vaccine ko aura. Dr. Alka na ikangan sa kapay na kita magima tinnitus ba natural.
Mr. Singh gabul gray moment nang ani na matela. Na ay tinnitus ng ba condition dongge no ba mamung bong jawa na vaccine ko mamung daljing ani green ana mat na ge.
Tao bun kami anteng sahen chambu bungnis ngani kunyang na doctor corona vaccine shugupa Karchian Gari Salano yeri irrelevant question on him yako saksoa
Next.
Okay, and last question Marcus CH Marako nikon niyang madam anga hemoglobin E sa dunga aro heart weak aro gusto ko now allergy dunga madam anga belongin weak nga anga ra biji ko shuna manggen magnes atina via hemoglobin E sa dunga na aro heart pa weak ona aro gusto ko nga kakati allergy ko nga via vaccine ko shuna na manjawa ne kaya atina Marcus CH Marako Dr. Alka yako nga natinga
Hemoglobin E tunggu parang heart saga parang dasi akan gemen kita comorbidity suka akhay rang ba ini kan ya maang vaccine ko na nang aka in ba dasi Dr. Sangma ba akan jok allergy acute unginga ode bawa semoyo nak ni vaccine na chanchi metong semoyo unginga ode kasapayo ko nak ni allergy nam kala ona defer kai mengna ba postpone kai mengna ani allergy nam kala o wag tok ni allergy nam kala o rana kita manggen me daw the vaccine de gamakchin freely available ini man ya ko mat rukcho ha daw tal knalo shuruk chaw de ngapa ongja ini man anak ni acute condition bo daw saing gapa allergy ko namat chinge mangna nak ni sipang bat ko doctor chi ai mangna wala treatment ra chinge mangna nani allergy namang khal joko rana manggen hemoglobin E sana aro heart weak ongpa na de mamang contraindication dongja mamang jajingani ba champingani dongja asong ya vaccine ko jajing gi rana manage dingba dashi Dr. Sangmani namme thalatang gemen geta allergy acute onginga no de wa ko nasong namat chinge mangna nasimang nama jamano yang na manggen anything else Dr. Sangma you'd like to add?
That's it. I think.
Betul lah, Dr. Alka. Ansung bon kam pa dalni bon kam ko pas ngani ko akan chapang na. Laxwell M Sangma dikis ngatinga. Kang pa dose ni kam ka anira baita sarangoni kam ka na machinga. Aro baita % safe and effective. Dr. Sangman aya ko ang natnagatamat gin ba? First dose ni jaman baitana rutani jamano anchingara ya vaccine ara anchingda belakatani hotnani bias katinga aro baita percent safe aro effective ngani dia winas kinga
we ya skangpa those could shown nangi antibody develop kana within some weeks at the most 2 weeks abatina taman gen ndakemna ndiba na second dose ko ragen chmo de node nangna bangbata nangna strong immunity ko na taman gen but the percent is winga skangpa those covishield around 60-70% protection ko na taman na ndiba when you na second dose ko rao de una nambata protection ko na taman gen about the safety and effectiveness, they are safe and effective. When you go ahead, you can take your vaccine.
Matela, Dr. Sangma, nambe thalatanina. Senganirang dongpugen chimo ba dal na dong so gumen somai de yanon bona ha. Na somai ko barang nas kugen chimo de singa email address ko natinga wano singat na gata magyen. Dalo anchingna COVID-19 sabishini gumben. Aro iya sabishi ko tukashwachi champing na manani gumben. Doktorang nambe thalatanga ha. Anga bibir ya thalata nirangchi na simangli dengtang kenanirang aro jajanirang na agan chakanipo manaha. Dalo chanchir mani kita anching gembekan tika shugen chmode. Aro COVID sabishina dun sogumen niam jekai masko name gengteng kusek aro kutupeko gupe gangen chmode. Aro jakrangko sabonchi name jakshu jungen chmode. Aro saksa sakupunani tangruki dongen chmode. Skango anching jekai Jajina bri jangi thang bainga chim wanda ke da oba school rango thang tha ni biap rango aro nuk thango maniani rango jinma bakran phaina gita maggen ya pandemic pas hajinma pasako machot ke nanching darang bagana gita manja diba ya sabisina tika rana rute singode ya sabisi patutut kang kugen aro ya virus ba jo ding thang roko mungina khat ken jika ada anjing getal kurang ko nak getal maknanya. Unigaman anjing sakantian COVID-19 ba coronavirus ko champing na dum suguman yam dikirang ko jarik na aro bak sumai ko radam bija chika shuna choko rana. Ya ko sanangan isuing ko sakantina kanat naska na simangi bakur anina metela. We have come to the end of this program. I thank the panel of doctors for enlightening us and answering to our doubts and confusion. And I also thank the audience for their active participation. Everybody is eager to get back to normalcy, either at work, at school, family gatherings, going to social events. And we have learned from today's discussion that the only plausible and long-term solution to the coronavirus is vaccination. We do not know when this pandemic is going to end. But waiting too long to get the vaccine will cause the virus to spread and also give it a chance to mutate and cause many variants like what we are facing now. So take charge of your health by taking the vaccine and continue to follow COVID-appropriate behaviors, which consists of 3 Ws: wear mask properly, covering your nose, mouth, and chin. Wash or sanitize your hands regularly and watch your distance and keep at least 6 feet from each other. I thank all the viewers for their participation. Good night to everybody. Thank you. Stay safe and stay healthy. Sakantikon Mitela Aro Wanam.
Jangini rama ng ijakon Namgija sabisi ko chachang na ba ng ijakon Chaksusrung mas ko ganirong talantali Jan mauro gijan tang duding tang samsake Ongija ko borang kuk na jana tika ko suwe haywara chakna Corona jat pasija kangal cha asiata Donga somoy cheyani damsan jaku dia chicken nagri kanal na kanal na kanal na kanal na kenagri kanal na kanal na kanal na kanal na for better tomorrow 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 for better tomorrow 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 kumong'e talat mo halat po, unat po.
National Health Mission, Government of Meghalaya.